John Pratt, host of Policing York Region here on Rogers TV. Today we're going to chat about mental health during COVID. We're trying to keep everybody healthy, and I want to see what YRP does on their side of the fence. After the break, we're going to have Dr. Kyle Handley come on. He's the lead psychologist who's on with YRP. But right now, I want to chat with Sergeant Chris Palmer with the Community Engagement Unit, and we're going to have a little conversation on what happens in his bureau. Chris, welcome to the show.
Thanks, Don. Good to see you again.
Yeah, you as well. Thanks so much for being here. We keep referring to social distancing, and that's this is a pretty significant voice to that right here, where I'm actually doing the video from my breakfast nook at home, and you're in all but an abandoned office. It's a very empty space you're in.
Yeah, it's certainly quiet from the regular days that we have in here when it's a full cadre of people here. So it's just myself, a couple of the command staff, and my teams that are working out of the office.
Yeah, and this is what everyone has to do, right? We've all got to do our part, and this really is just all part of it. Absolutely. So, Chris, I wanted to talk about you oversee the mental health piece with York Regional Police. Can you just talk about that a little bit?
Yep. So I supervise sort of the public-facing mental health delivery aspect of York Regional Police. So I have, and I'll talk sort of in the traditional sense because we've changed things up a little bit to provide services during this COVID pandemic. But in a general sense, I have on any given day 2 teams of police officers working with crisis workers from our community agency that we provide mental health support, frontline mental health support for. They're from York Support Services Network, YSSN.
Right.
They're crisis services at 310 Cope, and they work with my officers on the road to handle any kind of call that involves mental health, addictions, housing, sort of psychosocial issues that the public experience, and then contact the police for.
Right. So you had mentioned YSSN. Can we just chat about just what that network is about? It's quite a first of all, it's a great group.
Mm-hmm. Yeah, for sure. We've had this partnership with York Support Services Network for pretty close to 16 years now. Basically, YSSN it's a community-based agency that has a range of case management, community crisis services. They deal with individuals with developmental disabilities and serious mental illnesses. So they provide a range of supports. The piece that we partner with, particularly from York Support Services Network, is their crisis services. So the people that we partner with, that my officers work with day to day in the cars, providing frontline response.
So you, sorry to interrupt, Chris. So you actually have one of their members in with a police member?
Yes, yeah, absolutely. So I have teams of plainclothes police officers that work side by side with a crisis worker right in the car with them. So I have 2 of these cars out day to day. So they come from the crisis response piece of YSSN from 310 Cope, which are the crisis phone lines for York Region.
Right.
So the social workers and crisis workers that we deal with from that organization are very good at what they do, providing sort of in a regular day frontline crisis response over phones when members of the public are able to access 310 Cope. Bring that expertise to the cars to help the police respond to frontline calls for mental health in the community.
Right, and it's important to know that that those services are out there, right? I mean, I've always heard of with 310 Cope. Again, that's another incredible resource for people should they should they find themselves in trouble, or should they come across somebody else that's in trouble, right?
Yeah, absolutely.
So ahead of the show, we were talking about what are we seeing? What are some trends in mental health in the region? And understandably, when everything was first starting with COVID, perhaps it was a little bit of a dip in some of those numbers. But unfortunately, those numbers have come right back up, haven't they?
Yeah, strangely enough, we saw in the first 3.5 weeks a bit of a dip in the numbers of calls that we were attending. Which is welcome in itself. I mean, you hope that people are coping a little bit better with things, but given the circumstances, I think people just weren't contacting the police and looking for our assistance. I mean, I know there was a very large push right across the country for community agencies, just like YSSN and 310 COPE, to advertise in the public,
Yes.
giving the public an indication that if you're experiencing, some form of stress or inability to cope with day-to-day life because of COVID, then you're certainly welcome to call. So, those services, I think, were more sort of public-facing and doing a lot more advertising. So people might have been responding to that more so than contacting the police looking for that kind of help. But in the past couple of weeks, we've seen our numbers return back to where they were pre-COVID. So certainly my teams are busy still.
Yeah, and we always say that too, right? It's very unfortunate, but how wonderful that we've got these networks like your team and YSSN 310 COPE, all of these entities that work so well together and offer the support that's needed to our community.
Yeah,
it's so. Can you walk me through how does it happen? I referred to it before we started the show. How does somebody's name end up in a file on Chris Palmer's desk?
Yeah, well, a variety of reasons. There's a variety of reasons, obviously, that people contact the police and, or specifically in this instance, to look for assistance when somebody's experiencing a crisis of some form. Sometimes it's just the unknowing list. They just don't know who else to contact, so they contact the police, and thankfully we have the resources to help them with. Back in the day when I was a junior officer, those resources weren't there, and all you had was trained police officers. So now we provide training to all our frontline officers and answering calls where people are experiencing a crisis. And we partnered with our mental health experts in the field to assist us with that. Sometimes people are in such a crisis that they are either a danger to themselves or others. So these are an obvious call out in relation to when that is going on. Sometimes people just have an inability to take care of themselves in their day-to-day lives. They may find themselves in an emergent situation. They've fallen down, can't get back up, inability to feed themselves, house themselves properly. So we come into contact with people as a result of that.
Right. So you're really looking for where to best refer people to and offer the best support, right? Go ahead.
No, sorry. I was just gonna just talk about some of the things that we do or try to do when we do go to these calls. So
yes.
Yeah. So when people do contact York Regional Police as a result of some kind of crisis that they're in, my teams will always try to get to those frontline calls. That is the goal. Primary goal of the team is to help out frontline police officers, frontline uniformed police officers deal with the calls. So ultimately what we're trying to do is to get on scene of those calls when they're going on, conduct an assessment of the person that we're dealing with, the person in crisis, an assessment of their mental health status and a risk of harm to themselves or others. We do have the ability to apprehend an individual and bring them to the hospital to seek psychiatric treatment or further treatment if they become an inpatient at the hospital because they are, experiencing such a crisis or mental illness. And provide those frontline officers that are at the call with guidance and expertise in establishing those apprehension criteria. Because a lot of times what my teams are really good at are the initial de-escalation piece. So when an officer in a uniform, wearing body armor and a belt full of use of force options, tends not to be very calming for a lot of people, as you can well imagine.
Understood. Yes, of course.
So my officers that wear plain clothes, wear jackets, they cover up all their use of force options. Crisis workers, they're in plain clothes. They're less intimidating. They have the ability to better interact with individuals.
Absolutely. It's kind of the softer side of policing, isn't it?
Yeah, for sure. And we can help out with crisis management plans once we are able to effect some de-escalation in the person. And because of the kind of business that York Support Services is in, they're the front door to mental health assistance in York Region, so we can provide resources, supports, and referrals to the individual that we're dealing with and their support services. So if they do have family home, we can sit down and talk to mom or dad or an uncle or an aunt or a brother or a sister and describe to them the kinds of supports that are in the community that might be able to help their loved one.
Sure.
Yep. We have the ability to also pay a visit back a few days later, just to make sure that they have called their doctor, have made that appointment.
Yes. I love that. I love that follow-up piece. I love that you actually do follow-up. It's not not just reactive. It's also engaging, right?
Yeah, absolutely. Because the shorter amount of time that my teams are able to spend with them will sometimes help out with what might be a repeat call to frontline police officers, and then they get 4 police officers dressed up in the uniforms and are right back to where we started again. So if we're able to get in between our initial de-escalation piece and a reoccurrence of some kind of a crisis, then that is so much better for our the staffing that we have in the front line, so they're able to provide assistance to other kinds of calls. So
yeah, no, that's fantastic. Like I say, I love that it's not just a reactive piece; it's actually an engagement piece. Yeah. You're walking people. You're basically just helping them to that positive finish line. Right?
Yeah.
Chris, I always appreciate having a conversation with you. I got to thank you so much for being on the show. And folks, we'll be right back after the break with Dr. Kyle Handley. Thanks again. Welcome back, everybody, as we continue our conversation about mental health during COVID and what York Regional Police is doing to help us. And right now, we're going to speak with Dr. Kyle Handley, who is the lead psychologist with York Regional Police. Dr. Handley, thanks so much for being on the show.
Oh, thank you for having me, Don.
Yeah, so I got to get you to walk me through just what your team does. My understanding is this is an internal. We just had the opportunity of speaking with Sergeant Chris Palmer, who deals with basically, I'll say, with the outside of the house, with the general public and their challenges with mental health. But my understanding is you deal more on the inside of the house, as in on the inside of YRP. Is that correct?
That's correct, yeah. So my job is to serve the uniform and civilian members, as well as the families of all of the members of YRP.
Okay, so this is, I just want to bring a little bit of history for context for our viewers on just, I'll call it this package of mental health readiness that is part of York Regional Police. My understanding is this is something that was started some 10 years ago under the executive command of YRP. And it's, I would have to say it's done nothing but grow wings and take off in a good way for the organization.
That's true, yeah. So our executive command team over the past decade or so has placed a very high priority on member wellness and particularly mental health. And we've seen our programming that we offer to officers, civilians, and their families grow along with that. So we've gone from having a very small unit about 10 years ago that had only a couple of peer supporters in it, to now a very multifaceted team that includes psychologists, chaplains, peer supporters, physical health providers, and even a trauma support dog that are all available to support our members and their families.
Is that Blarney?
That's Blarney, yeah.
Yes. We had the opportunity of having Blarney on our show a couple of years ago. The peer support dog. What a fantastic little creature he is.
Yeah, and it's a great conversation starter, right? When we bring in Blarney, who's sensitive to some of the cues that people might be experiencing around trauma or stress, but might be a little bit reluctant to start a conversation with one of our support workers. Blarney can be a way to kind of help us begin that conversation with a family member or child or even one of our officers or civilians.
Oh, absolutely. No, I can definitely see it. I mean, it's no different when you're going into the hospitals and you see the therapy support dogs. I mean, everyone has a positive reaction, or I shouldn't say everyone. The majority of people have a very favorable reaction to a friendly little pup, right? But so, do you mind walking us through a little bit of how does this work? How does your team operate?
Sure. So I'm the lead psychologist for psychological services, and we provide clinical services internally to our civilian uniform members. Members can approach us either by self-referral, so they can get in touch with us directly to book an appointment, and it works very much the same as it would with an external psychologist, only that our services are entirely free, and we have a little bit more deep of an understanding of what it means to be a police officer, what are some of the experiences that our uniform and civilian members are dealing with on a day-to-day basis, and also how we can connect them to the best resources possible so that they can get the treatment that they need. We also respond to traumatic incidents in the field. So if there's a particularly difficult call that one of our officers or civilians has been to, we can proactively reach out to that member and provide services to them before they have to experience any of the symptoms that might occur as a result of that call.
Right. And you're always checking for mental readiness, though, right?
Absolutely. It starts right from the recruit level. We provide our recruits with a significant amount of mental health education, not just in how they can interact with people in the community that have mental health issues, but also their own awareness of their mental health. And we teach things like mental readiness, mindfulness. We get them acclimated to all of our resources, and we actually have a psychologist meet with them right at the first recruit stage when they walk in the door to help acclimate them to the fact that mental health is an important value for any police officer.
So as a new officer's coming in, you're already being introduced to them?
Absolutely, yeah. So we meet with them before they go off to their mandatory training with the province, and we meet with them after they've been on the road as a new police officer for about 6 months to a year, to help them contextualize some of the work that they've been doing and understand the impact that constantly attending difficult calls may have on them, so that they can build that resilience for a long career.
Absolutely, and I love that approach, right? I mean, it doesn't matter in what element we're talking about, but when you introduce something early, it's they grow with it, right? They grow with that knowledge, knowing that support is behind them. And when we talk about the support and the level of support, it's incredible just how much support you have for your own members.
Well, as I said, the executive command team deserves a lot of credit for making this a priority. They recognize that when we have safe and healthy YRP members, it leads to safer communities as well. There's fewer people going off work, people are feeling better when they're at the job, and they can more effectively keep the community safe as a result. So they've made a big investment in doing that, and we're proud to be able to help the community by helping our officers.
Yeah, so especially with any first responders, but in particular with police, I mean, that physical ability has always been the key component, right? Is that physical readiness, but the mental readiness is every bit as important.
Well, at YRP, we like to think of it as being a biopsychosocial spiritual approach. You can't remove any one of those elements. Sure, yeah. We call it a biopsychosocial spiritual approach. So it has 4 elements. And you can't remove any one of those elements without compromising somebody's wellness. So we try and ensure that the physical health of our members is well protected, that they have the mental health resources that they need to support themselves, that they have the social supports like our peer support team, and that their family health and financial health is well taken care of. And also that they have the availability of spiritual support. So that might be through religion, through our chaplaincy program, or that might be just finding ways that they can have a greater sense of connection to the organization and the community at large, to give them a sense of meaning in what they're doing and that their work makes a difference.
Yeah, so it's really not, I guess I'm just kind of separating the two. It's really, I guess I'm kind of seeing 2 main elements where the internal approach is of such great value. Of course, you have your traumatic experiences where, obviously first responders do respond to trauma, and they do see things that most of us just wouldn't do well with. But then there's also just that day to day. It could maybe be just how things are going at home, or how you're dealing with your day to day life.
Absolutely. We always like to emphasize that police officers are humans too, right? And they need all the same supports as anybody else would need if they're constantly faced with traumatic incidents, either at work or they're dealing with difficult situations at home. So when we see members for our clinical services, we always like to emphasize that you don't just have to speak to us about work, because it's not that easy. It's not easy to just separate your work from your home life. It's all mixed together. So we're able to provide any type of support that a member might need.
Yeah, no, and that's exactly, that's the separation I guess I'm making is it's not just one element. And the reason I'm emphasizing that is because when we think of police or any first responder needing mental health support, we automatically think of, perhaps it's because they encountered a traumatic experience, right? That's not necessarily the case, right?
Yeah, I would say the majority of what we deal with in my office is actually not related to a specific traumatic incident, but it's rather the totality of all of the stressors that can pile up in somebody's personal life and work life. And we try and treat those as a whole, as opposed to separating out any one element.
Right.
And we're certainly seeing a lot of that now, actually, with COVID-19, is that one way to look at the COVID-19 experience for a frontline worker is as a prolonged traumatic event, and trying to figure out ways that we can build the resilience in people that have to continue to be on the front lines while it's having an impact on the way in which they work, their connectivity with other officers in the workplace, and also how they interact with their family, because their family might not be as comfortable with having somebody interacting with the public to that degree, and then coming home if they have a vulnerable person at home or something like that. So this is a very important time to attend to our members' biopsychosocial spiritual needs.
Yeah, no, it makes perfect sense, and we always refer to as well when we're talking about mental health and reducing that stigma. It's always been there. It's always been prevalent, and it's very welcoming to see that bar is being lowered to significant levels at YRP, isn't it?
Yeah, and we've made significant strides to trying to address that stigma, because that is the biggest barrier that we have to improving mental health. It's not necessarily the resource availability. We have a lot of resources available. It's people approaching the resources, right?
Yes.
And so to address that stigma, we do as much as we can not to just be sitting in our offices and waiting for people to call. We want to be out there to meet with the officers. We go to parades very frequently. The parade is the meeting that we have before the officers report to duty and go out on the road. We get some face time.
So you actually attend those?
Absolutely, yes. Yeah. Right. So we can speak to the officers directly face to face, so that if they're not familiar with the services that we have, or they don't know who's providing the services, we can put a face to the name and interact with them a little bit more informally, so that they get to know us and might be more comfortable approaching us later on.
Right. So I'm just, as you're talking, Kyle, I'm thinking, what's the reception like? I mean, this is still a relatively new concept, bringing a psychologist team into a police service. How's the reception in-house?
It's been an interesting journey, actually. So I was the first psychologist that York Regional Police had hired. I've been here for about 5 years now, and early on, there was a lot of reluctance, because people didn't really know how to interact with me, or what type of services I would offer, or I get a lot of questions about, well, is it really confidential? And through the process of kind of explaining my role, explaining that I'm a licensed clinical psychologist, I have an obligation to hold their information confidential, that I can provide services to them related to their work experience or their home experience, and then just them seeing me more and getting more familiar with me as a person has really helped increase the number of people that are comfortable coming to me. And even now, when I walk around any of the districts or in headquarters, people stop me in the hallway just to have a chat. And that's something that wouldn't really happen very much when I first started. So it's a really good indication that people are becoming more comfortable with the service.
Yeah, and I love the approach. I love how you shared that you get out and you walk the hallways, you get out and you engage the meetings. There's nothing like being there. That's how to learn from the approach, right?
Absolutely. And that's another example of where Blarney really helps us, right? Everybody likes to see, a dog walking into the workplace, and it gets people kind of
It's a great way to have
out
it,
of their
Kyle.
seats. Yeah.
Thank you so much for being here, Kyle. This has been a great piece of information. Folks,
It's been my
that
pleasure.
wraps up
Thank you.
this episode of Policing York Region. Great having you. Look forward to seeing you again.